Hello everybody, my name is Andreas from CatchLife and we are here today with Dr. Kamil Manaf. How are you?
I'm great, how about you?
I'm fine, thank you. So tell me about your week. How was it for you?
This week is a little busy, but this is normal for us.
Yeah, I can imagine. Same as for us, many patients. So we got a lot of questions from our viewers and also followers.
Yes, I'm ready for your questions.
Perfect. So I will start with the first question if you're okay with it. So the first one we got was, after a face and neck lift, will my facial expressions and overall look remain natural, or if there's a risk of looking like in another person?
The goal is to restore a youthful image and youthful image. Not after the surgery, you will not look like another person. Just you will look like you.
Okay, so it's more like it's a younger version of the same person?
Yeah.
Okay, perfect. Should I skip to the second one? I think yes, we should.
Sure.
So the second question was, does a face and neck lift completely erases the sign of aging? And or will I just look a younger version of myself? Well, that's actually kind of the same question, I guess.
Yeah. As I just mentioned a moment ago, you will look like you, not another or different person. After the surgery, after the all healing process is completed, you will look like you.
And is it possible to eliminate all the areas, or how is it working?
It depends the patient's incurs. If he or she wants the just face, just we will focus on the face area. But sometimes we will do the face and neck lift at the same time.
Okay, perfect. I will continue with the next question in that case, and that is, how much can neck tightening enhance and define the jawline?
Neck tightening can improve jawline definition by reducing the loose skin and improving the muscle laxity.
Okay, perfect. Thank you very much.
Sure.
And how is it working with the jawline? Is there another way also to bring it in front, or is it just made with a neck lift?
Sometimes we will do the face and neck lift at the same time because it's just between the face and neck lift area.
Okay. And do you think a patient should also get Botox in the same time, or stick with the normal face and neck lift, or should they be combined?
Sometimes we will do the combined. If they need the Botox filler at the same time, we will do the after the surgery.
Okay, perfect. So I will continue with the next question of our viewers, and that will be, how soon after a face and neck lift can I expect to feel confident going to a social event, like being photographed, having a video shoot?
Yeah, most patients feel comfortable and attending the social events within 3 and 4 weeks. Yes, first 1 or 2 weeks they have the swelling and bruising, but it's normal because the face area is too sensitive. But I think 3 and 4 weeks later, everything will be normal and they will continue their daily life.
Okay, so it also depends from patient to patient, I suppose.
Yeah.
Okay, so let's say after 3 or 4 weeks, they can just continue with the normal social life they have before?
Yes.
Okay,
Yes,
perfect.
that's true.
That's good. So the next question was, which one was it? Will results be different in someone who had face and neck lift before? Let's say they had it when they was 40 and they want to have it again after being 60 because of some loose skin again.
Can you explain?
It's like, let's say, wait, yeah. So the question was, will results be different in someone who has previously had face and neck lift and maybe also facial fillers or Botox?
Yes, patients who have used the Botox and filler may have already have some volume and correction wrinkles. So we don't like this situation because we want to see the natural crease, folds, and aging and real anatomy. So, for example, if someone have fillers, for example, before the surgery, I want to do some injection for resolve the fillers.
Okay, so what is the best solution for patients who had Botox or filler before? If they really want to stick with the face and neck lift, what will be the best solution for them?
I think after the surgery is the best option because the face and neck lift is the not the small surgery; it's a big surgery,
Yeah, of
and
course.
it will be the big difference after the surgery. And if she or he needs Botox and filler, we will do that.
And how long approximately takes a surgery like that? Let's say face and neck lift combined in one surgery. How long does it take?
It takes about 3 hours, but sometimes it's a little longer, and sometimes a little shorter.
So I think it depends on how much creases and loose skin the
Yeah,
patient
yeah,
has.
yeah,
Okay.
that's true.
So the less the easier.
I think who has the thin skin, it's too easy. For
Okay.
us. Yeah.
Okay. That's good to know.
Yeah.
Where is the age gap?
Instagram chat, please.
Oh yeah, sure. Let me check. Yeah, sure. You can ask a question, of course. Let me check again. Bir soru gördün mü? Ben göremiyorum.
O geldi mi birisi yaptırmış ama.
Neyse o gitti benden ama. Okay, so let's wait for the question. And while, what is the best age gap in your opinion to have a face and neck lift? Would you recommend it for someone who's 30, or should they wait a bit? Is there a gap, or does it depend on the genetics, or how does it work?
It depends a lot of things. If you have the loose skin or after the sleeve gastrectomy, for example, you need the face and neck lift surgery because you have the loose skin.
Okay.
But I think if you have the your skin quality is good, maybe you need the older age.
Okay.
Yeah.
Okay, I get it. So we got one question. Do you perform face and neck lift the person who smoke? Do you have a red line for smokers?
Yes, we don't like the smokers
Okay.
face and neck lift surgery because we have some risks. So we always ask you will use the smoke or not, and we will suggest please stop it minimum 1 month ago.
Also, okay, so if you have a smoker as a patient,
Yeah.
they should stop with smoking 1 month prior to operation.
Minimum.
And for how long are they not supposed to smoke after the surgery?
The 1 month is enough.
Also 1 month, so they should stop for 2 months in total?
Yeah, yes, please.
Okay, so 2 months no smoking. Sorry for that, but it's crucial for the also for the healing, I guess.
Yes.
Here you have it. Smoking.
If the heavy smokers, we have the some healing problems.
Okay, so I wouldn't have it together because I'm a heavy smoker.
Yeah.
Okay, so sad for us, but yeah, quitting of smoking would be the best. Thank you for your question, by the way. If you have any questions further, just send it in. So I will continue with the other questions we had
Yes.
before. And that will be, yeah. So what is the likelihood of having visible scars around the hairline or ears after a face and neck lift?
All scars play in natural crease. Don't make as less visible as possible. Yes, first 1 or 2, the minimum 1 month, your scars looks visible, but after the whole healing process is completed, your scars is not visible.
Okay, so are the scars? Can you show to me maybe how the line goes?
Yeah, the scars starts your temple area, in front of your hairline and in front of your ear and behind your ear.
Okay, so it goes like here and then to the back.
Yes.
Okay, And when it comes to the neck lift, it's the same scar?
Just
Face and neck lift.
yeah, the same scar. We use the same scar.
Okay, that's perfect. So it's not visible because of the hairline also generally.
Yes, yeah.
Okay. So not that much visible scars, that's actually a good thing.
Yes, yes.
So that's perfect. So I'm checking here. Thanks you too, Dr. Gamil. Thank you too again. So I will continue with the other question. And that's it. What are some lifestyle habits that can help prolong the results of a face and neck lift?
Yeah, a healthy lifestyle is a key. So protect to your skin from the sun exposure, avoid smoking, and stay hydrated and stable the weight. It's too important for us.
Okay. So gaining weight after the surgery might result in a bad result? Or?
Yeah, bad result. Yeah.
Okay.
Because you have the loose skin again.
Yeah. And how is it with people? I had that question many times from patients we had. How is it with swimming, doing sports? When can they return to that life?
You can turn your daily routine 1 week later. For example, after surgery, 2 days later, you can do your everything. For example, go to shopping and visit somewhere, cooking like that. But you have swelling and bruising on your face, and you will use some medical corset, special corset. But I don't suggest do the sports.
For how long?
4 weeks.
4 weeks. So for a month, we should stop doing any kind of
Yes, but after
big activity.
4 weeks later, you can do everything. Everything is free, and you will take off your corset, turn in your daily routine.
Okay, that's actually pretty good. So just 1 month of resting,
Yeah.
not working, it's actually great.
Yeah.
After having a surgery, just chilling for a week,
Yeah.
for a month. So yeah. So we got one more question, actually a few more. What is the recovery time for this type of procedure? So we got that actually. So the recovery time was like 3 to 4 weeks.
Yeah, that's true. The first day you can stay at hospital, and then you can discharge. Yes, but the first 1 or 2 weeks you have the swelling and bruising. It's normal.
But you're still normal functional. You can go to shopping, as you said
Yeah,
already.
everything is free, and then just 3 and 4 weeks later, everything will turn the normal.
Okay.
Yeah.
Okay, pretty good. So we got a really specific question here. And it says, how long do the results last typically? And is it possible to remove the submandibular salivary glands?
Yes. Sometimes we will do that. If you need or you have the big salivary gland, we will remove them at the same time. But it depends your just anatomy.
So it's like it's different from every patient to each other?
Yeah.
And is that a massive procedure, or is it just like a small thing to do within the
It's a small thing. Maybe it takes 10 minutes more.
Okay, so it's a pretty quick thing actually.
Yeah.
So and it's only done when it's needed.
And you don't need another incision or like that.
Oh, it's made with the same decision.
Yes, of course.
Okay, that's actually good. So it's actually a pretty nice procedure, I have to say. So and it lasts. So is the result permanently?
Yes, all the face and neck lift surgery is permanent, but because of the gravity and the age, genetic, like that, yes, it will take maybe, for example, 10 years. But all this surgery permanent.
And how is it with the stitches? You said the scars are not that visible. Let's say I had a face and neck lift and I returned to my country after a week. How is the aftercare? Are the stitches permanently? Did they have to be removed, or?
You don't need to take out your stitches because I always use the resolvable sutures. Just I would suggest use the cream, the antibiotic cream or the anti-scar cream. That's all.
That's all that I have to do.
Yeah.
Just for how many weeks I have to do the cream?
The first 2 weeks you will use the antibiotic cream, and then you will continue the anti-scar cream.
Okay, so not much long of a care actually. So
yeah,
it's pretty short actually and easy made. So just 2 creams and you're good.
Yes.
Okay, that's pretty amazing. And how is it with when it comes to bad scarring? I heard from many patients they are afraid of keloids. Is that a thing, or is it really just something that's specifically genetics?
Yes, sometimes it's too rarely, but
Okay.
sometimes we will see like that
Mhm.
situation. It depends your genetic.
Okay.
For example, if you have another scars on your body,
Yeah.
if you have the keloid or hypertrophic scars, yes, you will have the same scar, same things on your face and neck surgery
Mhm.
too.
Okay, but it's like really, really rare, you say?
Yeah.
Okay. So I'm checking just for the comments. Doesn't seem to be something new for now. Mm, no, not yet. And I also get that question a lot. How is it? People really don't understand when it comes to normal surgery or aesthetic surgery. They always ask me, is it safe to do? What is the right answer to that?
Yes, the aesthetic surgery is the same to another surgery. We have the same risks.
Mhm.
So all our surgery before the surgery, we will do your blood test,
Mhm.
X-ray, EKG, and everything is fine. We will go to surgery at that time.
Okay. And how long do I have to stay actually in Turkey? Let's say I want to have to get it done.
Face and neck lift?
Yeah, face and neck lift.
Yeah, minimum 7 days is enough because we want to check you again before your flight.
Okay, so you do it after check by yourself with the
Yeah.
patient?
Yeah, of course.
Okay, that's good. So just to make sure everything's healing well.
Yeah.
Okay. And how is it with the medications in general? How many do I have to use? Are antibiotics needed or not?
Yeah, we always give the antibiotics
Okay.
and painkiller and antibiotic cream. That's all. You don't need another medication like that.
Okay, and when it comes to arnica, for example,
Yes, arnica is helpful for us because arnica reduce your bruising,
so just the bruising or the swelling, just the bruising, right?
especially bruising, but
Okay.
it reduces the swelling too.
So let's say I want to return to work a bit faster than usual, so it could help a bit.
Yes, yeah.
Okay, that's
You will
actually
use
good.
it.
Perfect. So if you use some arnica cream, that could also be a good help actually. Just checking for another questions. Doesn't seem for now. So is there something you want to add as a comment to patients who are coming for face and neck lift? What should they bring? What should they expect for the whole days?
Yeah. If you have your own medication, for example, diabetes and blood pressure medication, please use it. And if you use the blood thinner medication, please stop 10 days ago. It's too important for us. And yeah, that's all.
So it's also that's also a pretty interesting part actually. What happens if a patient says he has or she has high blood pressure and is using antidepressants? Is that something that would collide with the surgery, or is it just fine for them to continually use?
They will continue.
Just continue
Yeah.
as normal
Yeah.
and no issues with that.
Yeah,
So,
of course.
okay, that's good. That's good.
Yeah.
Let's see. Nothing new for now, actually. So, we got one question here. Would it be better to use the corset more than a month after the surgery, regularly but not often to use after this month? Would it be better?
I always suggest the 4 weeks, but some doctors suggest the 6 weeks. Minimum 4 weeks is enough, but if you want to use the more, you will use it. We don't have any problem.
Okay, but we have to use it at least for 4 weeks.
Yes.
So that's the minimum we have to.
Yeah.
But they can continue by themselves if they want to, so there's no minus in it.
Yes.
Okay. And how is it with the corset? Do I need just one? Do I need more? Where do I get it?
The one corset is generally enough, but
Mm-hmm.
if it's dirty and you don't want to wash it, you
Yeah.
can make another corset.
Okay, so it's better to have two of them
Yeah.
so I can wash one
Yeah,
of them
you
while I'm
always
using
change
the
it,
other
yeah.
one. And do I also have to wear it at night or just a day? How does that
All
work?
day is better for us, but sometimes if you are boring, you can take out, relax, and then wear again.
Mm-hmm.
Or if you have a special meeting, you can take out, and when you turn your home, please wear it.
So let's say I am 2 weeks after surgery and there's a big wedding
Yeah.
and I want to remove it for, let's say, 5 hours. Is that okay?
Yes, yes,
So it's okay just for that day?
yes, of course.
Okay, okay. Well, thank you for your question. And we got another one.
Yeah.
Should the patient use sunscreen after the surgery, especially to protect themselves from scarring on the incision area?
Yeah. The sun is too important for us. We always suggest the sun protect cream to use the all scars, because if you don't use the sun protect cream, maybe your scars is visible.
Oh, so they will be more visible
Yeah.
after the healing process?
Yes.
Okay, so the more shadow, the more protected from the sun, the better.
Yeah, and when we do our surgery in summer, I always suggest please use the hat or sunglasses like that. Please protect
The
your
areas.
yeah.
Okay. Can you show the areas of incisions for neck and facelift? That's something we did already, but of
Yes.
course we can.
Yeah, I can show all my scars starts here in front of your ear and behind your ear.
Yeah, perfect. So that's actually not. Is it one cut though?
One
Or
cut.
is it? So it's
Just one line.
It's one
One line,
line.
yeah.
Okay, so actually pretty small, is it?
Yes.
So it's just really. How is it made? Is it like a fixed scar, or do we have to go deep in, or is it just really?
First, we will cut your skin and open, and then we will see your muscle and soft tissue.
Mm-hmm. Okay. And when it comes to the muscle, many patients ask me, what is deep plane face and neck lift?
Deep plane is a just technique for face and neck lift surgery. I will do the deep plane face and neck lift surgery.
Okay.
I think the deep plane is more permanent than the other technique. Just in my hand.
And what is
Yeah.
deep plane exactly?
Deep plane is a just technique. When we open the skin, we will see the soft tissue and muscles. If we cut this soft tissue and pull up, this is the deep plane.
Oh, okay.
Yeah, just the layer.
Okay.
Yeah.
Perfect. Thank you for your questions. We got another one. Which technique do you use mostly? Yeah, so
Deep plane. Yeah.
deep plane. So is it always deep plane?
No, sometimes we will change it because we have a lot of technique of face and neck lift surgery, but I like it, and in my opinion, the deep plane is more permanent than the other technique.
Okay, so it's like safest and the most permanent that you
Yes.
think for.
Yeah.
Okay, perfect. So also thank you for your question. Let's see. So yeah, and what are the other techniques called? The names to
Oh, we have a lot of technique.
a lot of
Yeah.
So there's really much. Okay, there's another question. Is the recovery period the same for both techniques?
Yes. Maybe deep plane is a little takes a little longer because we cut a lot of layers.
Okay.
But it may be 1 week more, I think.
So just 1 week of
Yeah.
healing and okay, so that's actually not much.
Yeah, because you have the same scar, same incision, everything is the same. Just we will cut a little deeper line.
Oh well, yeah,
Yeah.
deep plane. So
Yeah.
it's in the name actually. What if it takes a week more? So it's not really much actually in that case. So try to work it, I guess. Okay, thank you also for that question. Getting good questions today, actually. Really important ones. When it comes to makeup, what is your recommendation on makeup
Yeah.
after the surgery?
If your healing process is completed, you will do your makeup. For example, the 2 weeks later, because the first 1-2 weeks, your wound start to healing,
Okay.
and after the 2 weeks later, you can do that.
Okay, so after the second or let's say third week to be sure, they can start to wear makeup.
Yeah.
And do they have to be careful on the incision area or
No, you
they
can
can
do
just
yeah,
okay.
everywhere.
Okay, that's good. So, not yet. So yeah. Because I get a question a lot when it comes to makeup.
Yeah.
Because that's the first thing that people are asking. Like they're out of surgery and they're like, when can I get my makeup again?
Yeah.
So
It's too important.
yeah.
For women.
We got another one. Can lip lift be combined to face and neck lifts?
Yes, sure. Sometimes we don't do the just face and neck lift surgery. We will combine the temple lift, upper and lower eyelid, the lip lift, like that. We will do that.
And is that a big change in the surgery or is it just really a small thing to add?
It's a small thing. Just you have the one incision under your nose, and we will do your lip lift. And if you need, we will add your surgery.
Okay, and how is the incision made? How big is it?
I think it's the 3 centimeters.
So it's like a
not
really
too-
small area here?
Yeah, just
Okay.
just here.
Okay, and is it the same with the face and neck lift incision? Is it less visible after the
Yes,
healing?
because we place the natural crease.
Ah, okay,
Yeah.
okay. And you say temporal lift. What is the temporal lift for?
Temple. If you have this sagging tissue on your temple area, we will do the temple lift. Temple lift is the brow lift, the same.
Okay.
For example.
So let's say I also want to get that area.
Yeah.
It will be a temporal lift combined
Yeah.
with the face and neck
And
lift.
just if we will add the temple lift, you will have another incision inside your hair.
Okay, so it's like
Just
in and of the hairline?
yeah. Just maybe 2 centimeters.
Okay, so also a good option for men's, I guess, because since you got hair here, or when you got hair, it's technically
And
invisible.
that incision is not visible because it's hit with your hair.
Okay, that's good. We got another question. How do you decide temporal lifting or eyelid surgery for the patients? Is cantopexy an option for everyone?
No, I don't suggest the surgeries our patients, because if you need or if you want, we will suggest it. For example, before the surgery, we will do our examination, and if you, I will say, yes, you will lose skin here. If you want, we will do the temple or brow lift,
Okay.
or cantopexy, upper and lower eyelid too.
Okay, perfect. So you just really do it when it's needed, or you suggest it if it's needed.
Yeah.
Okay. Thanks for the questions. We got one more. Do the sutures dissolve or do they need removing later?
All sutures dissolvable. You don't need takeout.
So nothing to do really.
Yeah.
Just let it heal and they dissolve itself.
Yes.
Okay, perfect. So no sutures to take out. So because I heard people are saying they're afraid that we are using stapling. Is that really a thing? Maybe it's an old school type or
No. Sometimes we will use that, but I don't suggest. I don't want to use it. And just I used one suture for stop your bleeding. When we will do your last check, I will take out that, and you don't need take out another sutures.
Oh, okay. So, but does it happen often, or is it rare, or?
No. It's we always use that,
Okay.
but you don't see because it's under the tape.
Okay, I get it. Okay, so it's really like after I'm gone, the sutures will dissolve, and
Yeah.
that's it.
Yeah, that's
Okay, perfect. We got one more. Can I combine it with body aesthetics, or should it be just be done by itself?
Sometimes we will do the body surgery at the same time, but I don't suggest to longer time surgery. For example, if you need the small surgery, for example, breast augmentation, arm lift, or just tummy tuck, yes, we will combine it. But I don't like too longer surgery.
Okay, so it also, I think, depends on the patient's health,
Yes,
how fit they are, and if it's a too big of surgery, you will separate it into.
yeah,
Okay,
yeah.
makes sense actually. So we got really good questions today. If the patient has facial threads lifting before, is it a burden for the surgery? Like, is it a bad thing or?
Yes, it is bad for us.
Okay.
We don't like. But if you have the thread lifts, yes, when we start your surgery, we will take out all the threads and then we will continue our surgery.
Okay, so it's not really a big burden for the surgery, so
Yeah.
you can still perform it. It's just a bit extra work, removing all that work and
Yeah.
then doing the normal face and neck
It's a
lift.
little difficult for us.
Okay.
Not for patients.
Okay, but would be the after result be the same to a normal patient with normal face and neck lift
Yeah.
and this patient?
Yeah, the same. Everything the same.
The same. It's just it takes a bit more longer.
Longer, yeah.
Okay. So in that case, if you had it done, if you have facial threads and you want to have face and neck lift, you can get it with no issues. Just takes a bit longer. That's it. So no problem with that. Thank you for all the questions. Let's see. So there's about one more with rhinoplasty. Can it be combined with a facelift?
Sometimes, yes, I will do that, but I don't like too much. Why? Because on face and neck lift surgery, we pull the right and left side.
Okay.
But in rhinoplasty surgery, we push your nose bone, the middle part. So it's a different direction.
Okay. So does it depend to the patient if it's suitable or not, or do you don't
if
like
the-
to do it at all?
Yeah, if the patient have the time, I will always suggest that we will do the separate time. But if she or he don't have the time, we will do that at the same time.
Okay. So, but mostly you would likely separate it
Yeah, yeah.
just to make sure, I guess.
Yes.
Okay. Do you advise fat transfer to the cheeks if the patient has low volume on the area due to age?
Yeah. If they don't have the volume, yes, we will do the grafting at the same time. But it depends your skin or your face anatomy.
Okay. And how is it with the filler or the fat transfer? What is better? What is the most thing you are doing, or let's say, which one is more permanent?
Fat transfer is more permanent. It's your own tissue, and when we do the your face and neck lift surgery, we will harvest your fat tissue at the same time. But if you are afraid the surgery, for example, liposuction or fat grafting, we will do the filler. But you will do your filler every, for example, 1 year.
Okay.
It's not the permanent.
But when it comes to the fat transfer, it's more permanent than the
Yeah.
filler. Okay, so fat transfer makes more sense. And let's say I have the decision made, okay, I want to do the fat transfer with the face and neck lift. Where do we get that fat from? Like, from which part of the body?
Abdominal area is better, but
Okay.
sometimes we will do the tight fat removal.
Okay, so I will be suitable for it?
Yeah, yeah.
Okay, perfect. That's good to know. So we got one more. Do the sutures dissolve or do they need removing later? You skipped, yeah. We answered that already.
Yes, all sutures dissolvable.
Yeah, so they are just dissolvable, no need of removing them. So how long does it take for them to be completely gone?
1 or 2 months.
1 or 2 months.
But
Okay.
all sutures inside your skin, it's not visible.
Okay, but the ones outer that will be dissolving after 1 or 2 months, they're completely gone.
Yes.
Okay, so after 1 to 2 months, you are suture free and good to go to the next wedding, I guess. Some patient wants an aggressive lift on the face and neck area to make a very tight look at the results. Is it possible?
Yes, I always do as possible as much tight. because when your healing process is completed, your skin a little loose. It's a normal, natural, but I don't pull up a little.
Okay.
On surgery, I will pull up as possible as much.
Okay. And how is it? Because when you have patients, the most of them say they want a more natural look, and then you get patients who says pull as hard as you can. Is it something that you always do then?
After the all healing process is completed, you will look natural. I promise. Yeah,
Okay.
Yeah.
So it's more a nice natural look always.
Yeah.
Okay, that's good. And so yeah, for example, his question was that what I meant is most of them want a natural look, but there are also patients that want a really aggressive lift. Is it possible? Do you recommend that?
No,
Or is it always like it will be natural anyway?
I don't recommend, because if we do the aggressive surgery, we had some risks. For example, the blood supply is stopped. So I don't suggest the aggressive surgery.
Okay, so just a normal one, normal deep plane with a natural look at the end.
Yeah.
Okay, so that's good to know. Thank you all for the questions. Let's see. And let's say, what is the most popular combined surgery when it comes to face and neck lift? What is the most thing that is combined with it?
Most popular surgery, face and neck lift with upper and lower eyelid.
Okay, and how does it work with the upper and lower eyelid? Where are the incisions? Are they also dissolvable?
Yeah, the same, all sutures dissolvable, but you have another incision. The upper eyelid incision is placed your fold, and it's not visible when your eyes is open. And the lower eyelid incision is under your eyelash. And after
Okay.
all the healing process is not visible too.
Okay, so it's more like as stitches that you make it from inside.
Yeah.
Okay, okay. We got one more. Do you use lip implants?
I never use the lip implants.
Never?
Yes, never.
Okay. Why is that? Do you don't recommend it?
I don't recommend it. Yes, we will use the breast implant or chin implant, the face implant.
Yeah, like the
that.
cheeks, right?
But
Yeah.
lip implant is not the natural, I think.
Okay. So for the lips, it will be better to use Botox or fillers?
Fillers and fat grafting maybe.
Fat grafting
Yeah.
to the lips is
Yeah, yeah.
possible?
And
Okay.
lip lift is enough.
Lip lift.
Yeah.
So what is a lip lift exactly? Do you add something with it, or how do you do it?
If you have a thin lip, after the lip lift surgery, your lips will be bigger.
Okay. Okay. So, but it's a more permanent to the filler, right?
Yes.
Okay. So you would recommend to do it with the face and neck lift surgery than having it with the filler, right?
Yeah.
Okay. And when it comes to implants, you mentioned chin implants.
Chin. Yeah.
What is that for? How does it work? Who is suitable for a chin implant?
This treatment is a permanent surgery. If your chin bone is too small, and your side view is not good for you, we will do the chin implant, the middle part. Yeah.
And is it also possible for the jawline? Let's
Yeah,
say...
we have a lot of areas, another different shape implants.
Okay.
The malar, the jaw, chin, like.
And they're also suitable in combining with the face and neck?
Yeah, of course.
Okay, so they can just get it done all together in the same surgery, right?
Yeah.
Okay. So there's one more. Is there a specific age for face and neck lift? So that's kind of the same question I asked.
Yeah.
So he's asking, can a 20 or 30-year-old patient group have the same surgery depending on the need?
If you have the loose skin, we will do the 20 or 30s. No problem for us.
So, for example, you said sleeve patients,
Yeah, for example.
for example, they can also get it and will have the same after result as the patient will be 50 or 40 and have
Yeah.
it done. Okay. Okay. So, what is the first thing you look at a patient and you say, okay, you need a face and neck lift? Like, how do you define it?
The first thing is the loose skin.
Okay,
Yeah.
and when it comes to me, do I have loose skin? How do I think I have loose skin or I need a face and neck lift?
Sometimes in front of your ear you have the wrinkles, so
Okay.
it called I need the facelift surgery.
Okay, I get it. What is
Platismoplasty.
yeah? What is I heard it for the first time actually.
It's a technique, just a neck lift technique.
Okay.
If your neck muscle is separated, we will do the together.
Okay.
Make together. It's names the platismoplasty.
Okay, learn something new.
Yeah.
It was the first time for me to hear that. And what will collagen supplements help with the recovery?
Yes.
Does it affect it really much, or how much does it affect it even?
Really much, because we always suggest everybody use that supplements
Okay,
for your healthy.
so is it more like I will recover faster, or what is it good for?
Recover faster.
So the recovery is faster, so but the stitches will be the same.
Yeah,
Like
yeah.
the same.
And
It will not be visible, but
and that
won't change it.
supplements support your own tissues.
so the skin tissue.
Yeah.
Okay, perfect. So you will always recommend to use it?
Yes.
Okay. For how long, for example? For how long should I get the collagen treatment after the surgery?
All your life.
All my life,
Yeah.
okay. So, if the patient have diabetes, what should they do to help recovery?
If their sugar levels is normal, we will do their surgery and we don't have another problem. But if they some irregularities, we will suggest firstly please regulate your blood levels and then we will do your surgery.
Okay, so with a high diabetic level, you might even cancel the surgery or
Yeah.
say you won't do it for now.
Yeah.
And let's say you did a surgery on a patient with diabetes who has okay level, like normal level. Is the aftercare the same for them? Or the recovery?
Everything is the same. Just if somebody have the diabetes, just we will see the healing problems. But if the levels is normal, everything is the same.
Okay, and if they see some kind of healing problems, what could that be and how could they help that?
Firstly, we will just wait with use the antibiotic cream and all wounds healing itself. We don't need another treatment. But sometimes, if we see a big problem, maybe we will clean and suture again. Just,
okay.
It's too rarely.
Okay.
Just in case.
Okay, so the better thing is really just to get it regulated first and then come back for the surgery to be done. Okay. And also a question I got a lot with massages. The patients are asking they need any lymphatic massage after the surgery.
Yeah, all the surgeries, the lymphatic drainage help us.
Okay. And
if you do that, your swelling go quickly.
okay, so let's say I wanna go to a job interview. I wanted to go down faster. That will definitely help.
Yes.
So let's say I use the Arnica cream, I use my Scar cream, I get massages. So
yeah,
this all will help. And can I combine that kind of aftercare together?
Yeah. We always suggest it.
That's good. So we got one more. How do you decide between SMAS application and
mastectomy
or deep plane techniques?
It depends your soft tissue quality. For example, if you are younger and you will want a little lift, not too much, we will do the plication like that. But
Okay.
if you have a lot of loose skin and laxity, I always suggest the deep play. Just it depends your situation.
So it's just like what was this called? Application. It's
It's a
you do less layers than on a deep plane.
yes, it's an application. Just you do the suture. That's all.
Okay.
Not cut your soft tissue. For example.
Okay, okay. So the healing, I guess, and the recovery is a bit faster on it.
Yeah.
Okay, but it's only really suitable for people that are still pretty young and just want a
Yeah.
lift,
Yeah.
just a
And,
light lift.
please don't think techniques names because it just this is our works.
Okay.
Please, the doctors think it about all
So
these
always
things.
trust the doctor, trust
Yes.
the professionals in that case.
Yeah.
Okay, we're gonna do that. Yeah, well, interesting questions though. Okay, let's see if we get more. Do you recommend lymphatic drainage or other therapies post-op? And if so, when?
The lymphatic drainage massage is enough. The second weeks you will start it.
After the second week?
Yeah.
Okay.
Yeah.
Is it really needed after the second week? Or let's say I want to do it after the first month, would it be the same
The
aspect?
second week is better. Why? Because you have a lot of swelling the first weeks. So, for example, if you start the 1 month later, you don't have the too much swelling.
Oh, well,
The-
yeah,
the-
okay, that's right. And how is it with the pain in general? Let's say I got a face and neck lift and I have pain. What kind of painkillers would help? And for how long do I have to be pain
Yeah.
in general?
Yeah, the first night maybe you have a little more pain, and
Okay.
we will give the strong painkiller. But when you discharging, we will give the painkiller again, but you don't need the strong painkiller.
Okay.
And the pain level depends and change person to person.
Okay. But it's okay, you say so. If you say you don't need strong painkillers,
Yeah.
it's
You don't
actually
need,
not that
yeah.
bad. So, okay. Thanks for the questions. We got even more. What is recovery and how long do I wear the corset?
The corset you will use the 1 month at least, yeah.
So at least for a
Yeah,
month.
yeah.
And the recovery time.
Recovery the same. The 3 and 4 weeks is enough.
Okay.
And
And after that,
you
you're all
don't
good.
have swelling, bruising, and less visible scar like that.
And as you said already, so you stay 1 night in the hospital after the surgery.
Yeah.
The next day you're going to be discharged, and after 6 to 7 days, after you had an after check, you just fly back home, and that's it.
Yeah.
And then just using antibiotic creams
Cream.
and
Maybe if you need the pain
Yeah.
killer.
okay. So it's actually pretty quick. So
Yeah.
1 month is not really long actually.
The same in other surgeries.
Yeah, it's kind of the same actually,
Yeah.
right? Yeah. Okay, so let's see. How is it when it comes to drains? Do we have patient drains after face and neck lift? Or is it
I
just when it comes to liposuction?
Yeah, I generally don't use the drains for face and neck lift surgery, but sometimes while the surgery, patients have a bleeding, a lot of bleeding. So at that time, I will use the drain.
Okay, just to make sure it will not stay inside, so it comes out normally and then.
Yeah.
And would you remove the drains the next day or
Next day, yeah.
the next day?
Generally,
Okay.
next day.
So before the patient is discharged, the drains are out and
Yeah.
all gone.
Yeah.
Okay, that's good. When can I start using scar reducing creams?
Anti-scar cream.
Yeah, anti-scar cream.
Yeah, anti-scar cream. The third weeks, you can use it.
So after the third week,
Yeah,
it's
yeah.
fine. So
Yeah.
even when you still have the suture in, you just put it on, or
But all sutures inside your skin. It's
Yeah.
not visible. Just apply your anti-scar cream. That's enough.
just on the incision area,
Yeah,
right?
yeah.
Okay. And for how long should you use it?
Scar cream,
Yeah,
3 months.
for 3 months.
Yeah.
Okay. So that's what does it really do? It's just to make the scar less visible,
Less
or are there other effects
Because
also?
all scar cream include the silicone. Silicone is reduce your visible scars.
Okay, so the more I use it, the less visible
Visible
scars I
scars,
have
yeah.
after. Okay. So for 3 months you have to use the cream, and then actually good to
Leave
go.
it, yeah.
Yeah. Or are there cases the patient has to use it longer, or is it like really fixed? Like after 3 months it's not needed, or
After the 3 months, you don't need. But
Okay.
if you want, yes, you can use it.
well, in that case. And what type of cream do you recommend the most when it comes to anti-scar cream?
If the cream include the silicone, is enough for us.
So it's like natural silicone, or
Yeah,
it's like normal silicone,
yeah,
it's like
normal
an
silicone,
ingredient. Okay. Perfect. So let's see, more questions, not yet.
I think that's all.
Yeah, that's all for now, I guess. So we had a lot of questions today. We
Yeah.
discussed a lot. And if you have any further questions, you can always contact us on Instagram, on TikTok, or even via mail if you want to. That's up to you. And yeah, that was it, I think.
Yeah.
So thank you all for joining. It was a pleasure. And also really great from you that you were here. Thank you for that and for answering all the questions.
You're welcome.
And hope to have a live stream again in a few weeks, maybe,
Yeah,
or a few
maybe,
days. Let's see. Maybe with another topic, with breast cancer or something, or tummy tuck, for example.
Another surgical is
So
better.
yeah, thank you all for joining, and wish you a great day and evening.